Rev-Up office numbers are 572-0383 and 572-0215. Rev-Up St. Lucia, the alpha of radio.
Join Dr. Leonard Surage on Rev-Up St. Lucia 97.1 FM Tuesdays from 6 p.m. to 7 p.m. for Doctor in the House. This 1-hour discussion call-in program delves into the science of various diseases, treatments and medical processes, and offers in-depth explanations to empower listeners and help ensure a better understanding of healthcare for all. So tune in on Tuesdays from 6 p.m. to 7 p.m. for Doctor in the House with Dr. Leonard Surage, only on Rev-Up St. Lucia 97.1 FM. Doctor in the House, brought to you with the compliments of La Place Salison, the Library Credit Union, and Tapio Hospital.
At Tapio Hospital, caring and competent obstetric consultants will see you safely from prenatal care through delivery with a team of excellent pediatric and anesthetic support. Tapio Hospital, where the patient safety comes first.
At Library Cooperative Credit Union, we have one simple goal: to help you grow. Because when you grow, possibilities expand. We're about growing wings, growing ideas, growing you. This is your time. A time when your plans and dreams fall into place. When what you thought to be impossible with our support is indeed achievable. And best of all, it's a time when you can look back and see your growth. So, on life's journey, set your goals high. We'll be with you every step of the way. And as you grow, so should your opportunities. Library Cooperative Credit Union. We're not a bank. We're better.
It's delicious.
La Place Salison is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Place Salison, of course. La Place Salison, Castries, Rosalie, Beaufort, and Soufrière.
It's delicious.
It's now time for Doctor in the House, hosted by Dr. Leonard Surage. Dr. Surage, a very good evening to you.
Good evening, Andre. Good evening, listeners. Good evening, viewers. Welcome once again to Doctor in the House with your host, Dr. Leonard Surage. We do this every Tuesday, and today being Tuesday, 3rd of June, 2025. Just to remind you, this is hurricane season.
Mm-hmm.
And so today's topic is about an introspective aspect of a doctor's life. It's what makes a good doctor. You ever wondered what makes a good doctor?
Good question.
Well, the theme will be discussing what makes a good doctor from the point of view of the doctor fraternity themselves, from the point of view of the patients, from point of view of the community in which they serve, and from the point of view of the environment in which they work, their bosses, their employers, if they're employed by anybody else, because all these entities would have a different spin on what a good doctor is. And so today I thought, let us deliberate on what makes a good doctor in our opinion.
Let me just disturb you just for a second. Those of you watching us on Facebook, YouTube, and X, realize there's a shot there that's a little fuzzy. Please don't worry about it. We're currently working on that, so that should be straightened out in the not too distant future. Okay? All right.
Good. Thank you. And if you want to make a contribution, you can call on the landline at 572-9710 or WhatsApp 287-0971. So let us press on. What makes a good doctor? Sorry, from the point of view of the doctor fraternity, in other words, your colleagues, because what your colleague expects of you is different from what the general public expects of you. So good doctor is supposed to be somebody, is a multifaceted thing. Different people have different opinions, and the opinions vary. To truly understand what constitutes a good doctor, we need to examine the characteristic valued by the doctor themselves, their patients, the hospital in which they work. From a doctor's perspective, a good doctor, which is a good colleague, must be somebody who's medically trained and who is up to date with their medicine. In other words, they understand within the confines of their own profession, their own specialty, or their general nature of their work. They must keep abreast with what is happening. And I'm proud to say that in St. Lucia, we are perhaps one of the few Caribbean countries who ensure that our doctors are up to date by having a legislation that allows the doctor to go up for renewal of exposure by remaining current. So every year they have to show that they have been attending at least 20 hours of training or of revision for them to be registered. And in St. Lucia, every 2 years, doctors come up for registration and they have to meet these requirements. So being up to date is an important facet of being a good doctor as far as other doctors are concerned.
Mm-hmm.
You have to have good diagnostic skills, meaning that you should be able to listen to the patient's history or the patient's complaints and ask the relevant questions and then come up with a working diagnosis. And then you proceed to examine the patient to find out whether what you are hearing the patient saying is matching what you are finding.
Mm-hmm.
The examination and the questioning alone generally can bring you a diagnosis in about 80% of the times. But the other 20%, you may have to do some investigation, whether it is blood work, whether it is X-ray, whether it is ultrasound. Everybody is going for MRI these days because they feel MRI is more state of the art. But every investigation have their weaknesses and their strengths. However, and a good doctor would know that. So you don't put a patient through an expense of getting an MRI just because it's available and just because it sounds impressive. You have to look at the cost of MRI and look at are you getting, for that amount of money you're spending, is there another way of getting the diagnosis? Or that's the only way you can do it. And if that's the only way, you feel justified. But in these areas, your colleagues expect you to use your best judgment and look at the patient's best interests and don't make them spend money that could be avoided. So that is part of you being a good doctor as far as your colleagues are concerned. And also, you must practice what we call evidence-based medicine, meaning that you don't practice medicine by hearsay. Oh, everybody said causal leaf is good to make you sleep, and therefore we start prescribing causal leaves.
Mm-hmm.
Or they say, well, this particular medicine can do A, B, or C. We have to go by evidence, what the research is showing, because what they will do is that they will take causal leaf and give it to 100 different people, 1 leaf, 2 leaves, 3 leaves in tea or in oil or whatever, and to ask them or find out if it makes a difference to them. And that kind of evidence-based practice is what we recommend, that before you start prescribing patient medication, be sure that it's doing what you want it to do, and be cognizant of the side effects it may have. So the importance here is that your colleagues expect of you that level of responsibility, because the patient may not know, and therefore you have to guide them accordingly. Also, remember, diagnostic skill is about troubleshooting. I mean, I go take my car to the mechanic. They're quick to change parts for you without actually doing the proper troubleshooting. And after they've changed the part, you go up and then you discover that the noise is still there. So you have to go to something else. So troubleshooting is the heart of medicine. You hear somebody say they have a cough, it has been for that length of time, they were exposed to A, B, and C, and so forth. So you have to listen to the story. We call it story because it's a history. And listen to that and ask the relevant question and see if you can come up with an answer. So that is the diagnostic thing you have, and basically it is based on an algorithm. You begin to look at the answers. If they say no to this answer, then you look for other ways of eliciting a response. So generally, doctors have the capability, or they've been trained to troubleshoot. And so your ability to troubleshoot will determine how good of a clinician you are. And in doing so, you take consideration for everything that you have at your disposal. And there is also what we call continuing professional development. When you are trained in basic medical science, you are trained to a certain level before you go and specialize. That training, what they say is that you have to remain current in your training, and that is your continuing medical education, continue your medical education. There is another level. If you're going to add something new to it, or you're going to go into something else, for example, you decide, okay, you're a general practitioner, but you want to know more about hyperbaric medicine. So you're going to do extra training. You go overseas, and that's what most of the training is. You come back as a specialized person in hyperbaric disease, bends and that kind of thing. And therefore, that is called your continuing professional development. And you may not develop only in medicine. You may develop in other areas where you can help the community. So all this is part of being a good doctor. You may not have thought of it that way, but it is our responsibility is not only to cure a person, but to see what environment they're going into. The treatment you give them, can they afford it? And can they, the side effects, is it bad enough so that the patient cannot tolerate it? And so forth. So this is all part of being in the eyes of your peers, being a good doctor. Of course, you must have that collegial type of relationship, the manners, the etiquette, the thank you, yes, please, and that kind of thing. And when most times you are approaching your colleague, trying to negotiate a deal for your patient. For example, up to before I came here, patient called me and told me, we discussed the result, and I said, you must see another doctor immediately. And I now have to negotiate with the doctor. He himself was not in, but he arranged for his secretary to find a space in between to accommodate me. Now it means that so you have to be at good terms with your colleagues. You have to have that kind of approach that he doesn't feel that you are impressing upon him, and so he will accommodate you. So all these we do for our patients, but it requires a certain amount of tact, a certain amount of etiquette from us to be able to do it. So that is the kind of thing your doctor expect of their colleagues.
Okay, Dr. Surage, we'll have to take a little break.
All
but
right.
When we come back, I have a good question for you.
Okay.
When we come back. This is Doctor in the House, live on Rev-Up Slu, brought to you with the compliments of La Place Salazon, the Library Credit Union, and Tapion Hospital.
Tapia Hospital Radiology Department offers 24-hour service. We provide you with X-ray, CT scans, and ultrasound imaging using the most modern equipment that produces the best images for your medical attention. Call the Radiology Unit at 459-2201. Tapia Hospital, where the patient safety comes first.
At Labrie Cooperative Credit Union, we have one simple goal: to help you grow. Because when you grow, possibilities expand. We're about growing wings, growing ideas, growing you. This is your time. A time when your plans and dreams fall into place. When what you thought to be impossible with our support is indeed achievable. And best of all, it's a time when you can look back and see your growth. So, on life's journey, set your goals high. We'll be with you every step of the way. And as you grow, so should your opportunities. Labrie Cooperative Credit Union. We're not a bank. We're better.
It's delicious.
La Plaza Salazar is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Plaza Salazar, of course. La Plaza Salazar, Castries, Rosalie, Beaufort, and Soufrière.
It's delicious.
This is Doctor in the House live on Rev-Up St. Lucia. Let's say welcome back again to Dr. Surage.
Thank you, Andre. Welcome back, listeners and viewers. Remember that we are doing a topic on what do you expect of your doctor? What makes a good doctor? And I'm sure you have your views on it. I would like to get your views on that as well. So if you can, we are encouraged to contact us and send us a call on the landline 592-9710 or
572.
9710 or WhatsApp 287-0971. Give us a call.
Okay, so let me give you a call now, Dr.
Give me a call
Surage.
now.
All what you said there is beautiful. I like all what you said about what's expected of a good doctor.
Mm-hmm.
But the question is, who's guarding the guard?
Well, who is guarding the guard? There is an ethics committee in the medical council. The medical council is the guardian of the public. It is not an association of doctors. The doctors have their association called the St. Lucia Medical and Dental Association. This is an association of professional bodies that look at the interest of the doctors and the interest of the public at large.
Is that an organization in St. Lucia?
Yeah, the St. Lucia Medical and Dental Association.
Right, but you mentioned another organization.
Right, the St. Lucia Medical Council. The council is a body that looks at the best interest of the public in relationship to the doctors. So they set the guidelines, they set the agenda, they set the standards by which doctors should operate.
Now,
so all these things like the CME, continuing medical education I'm talking about, is they are the one that say, doctors, you cannot remain like before, say 40 years and don't read a book. Therefore, I expect you all every year to show 20 hours of studying and show me, and they're very strict on the evidence. You can't pull out anything from anywhere. Either you've traveled, because up to last week, 2 weeks ago, I was in Trinidad doing a conference for 5 days so that I can accumulate about 21 credits, which is every 2 years, every year you must show 20 credits. So these are the level of seriousness they have. And they also ensure that your registration remains current. Of course, some may fall by the wayside for whatever reason, but generally speaking, the medical council acting is the protector of the public from the medical practice.
So who does the medical council liaise with?
The medical council is set up by the Ministry of Health, and they deal with complaints relating to doctors, and there's a format by which they actually practice. They actually can lodge the public can lodge a complaint. So
but I mean, Dr. Surage, beside that, how will this council monitor? For example, you said you went to do some hours at a conference.
That's right.
How does the council monitor that? And you're not the only one. I mean, they expect, as you said a while ago, you have to expect you to read a book, I guess, on the latest happenings in the world field of medicine and so on. They expect that of you. But how do they actually monitor it? How do they know?
How they monitor it?
Yes.
They will, when you go to the conference, every day you log in for the day, and then every speaker, you have to make a comment on the speaker. And at the end of every session, you have to evaluate the class you attended and and give them a score. And every day, this is accumulated by the entity that conducts the exam, the meeting. At the end of 3 or 4 days, they would look at all the days you attended and all the comments you make, and then give you a certificate of attendance for that number of hours. And that's the certificate. Usually it is verified by an international body, like for example in ENT, it is the American Association of ENT Doctors. They will be the one monitoring that the course is conducted and give you your credits, and you take that to St. Lucia and tell them, look, this is what I have attended. Similarly,
so how does the council get involved now?
The council will say, when you're ready for re-licensing every 2 years, you must show, there's a list of about 15 different things you have to show. You show you attend, you show you pay your fees, you show you have a police record, you show from the council that nobody has any claim on you, and all these things. We are held to a very high level of accountability.
So does that apply across the board? Do all doctors keep up to date in St. Lucia, or there are some who fall by the wayside?
They cannot fall by the wayside because they will not be registered the following year.
Okay.
Because you have to show the 20 hours of credit from a reputable source. They would even do some what we call primary source verification, whereby they will call the organization and say, well, I heard you at a conference there, tell me more about it. Because I usually carry the brochure for the meeting. Usually it's a 5-day meeting, every day you can see what you did, etc. to carry it. So that is the extent to which they try to keep up. And similarly, many credits are now given online by Zoom, by this, by that. And these usually they can know if you attend because you log in, etc. And therefore, they would issue you credits. Usually not many, about 1 hour. Usually these are 1 hour, so you accumulate it over a period of time. But generally, you will not be relicensed. It's a headache for relicensure. It's for you to be relicensed if you don't have all these in place. So, have I answered your question?
Yes,
sir?
yes, you certainly have.
Right.
Certainly have. Yes.
So, so this is, and I think many countries. What I said when I said St. Lucia is one of the few countries who started off. Up to this time, there are many countries in the Caribbean whose legislation does not allow them for re-registration. Before we had our legislation, a doctor would come in to St. Lucia and remain in practice for 20, 30 years and no relicensing, just a one-time license. So you're not called upon to show evidence of continuing medical education. And so our legislation has been redone. I think it's a 2006 legislation, but didn't come to be practiced until about 2010 or something like that. So, but our legislation is fairly current to be able to deal with that, because a doctor can always tell you, where in the law that tells me that I have to register? And so now we do have it. So I'm saying from that point of view, and there are many fairly advanced countries within the Caribbean setup that doesn't have the requisite legislation to do that.
Mhm.
So that is one of the areas in which we are called to account. And your medical council should not be mistaken for your medical association. The council is a regulatory body to regulate the standard of doctors' practice. And the medical association is an association of professionals
Mhm.
that has a goals and intent of protecting the public and protecting the doctors.
So almost like a second layer of protection. Because you have the council and you have the Medical and Dental
The
Association.
Medical and Dental Association is almost like your bar association and your nursing association. It is an association of professionals that look at the best interest of the professionals. So they would go in negotiation.
Okay. So not necessarily for the patient, but more so for the.
Because they are a professional body that looks into the affairs of the doctors.
Understood.
And the same for the nurses and so forth. But your council is holding your doctors' feet to the fire to ensure that, because the council acts in the best interest of the public, not the best interest of the doctor.
Now, I want you to hold that thought, that the council acts in the best interests of the public.
Yeah.
I want to get back to that when we take our next break.
All right.
Okay? Because I want you to give us an example of a situation where the Medical and Dental Association acted in the best interests of the public, because we many times get the impression, almost like how we see lawyers and so on, that you rally around each other, especially in times of crisis. If there is something happening, something untoward, maybe some allegations be made against a doctor, we tend to see you as taking care of your own, to make sure that the people in the association are protected. A lot of people view the medical association like that, the lawyers, you understand, the bar association, that you'll rally around each other, especially in times of crisis, and tend to protect each other.
Association.
Yes.
Is different.
Yes, I'm talking about the association.
Okay.
So I want you to give us an example, right? If you can, where the Medical and Dental Association actually was there to protect the best interests of the public, the patients. Okay? As I said, if you can. So let's take a little break. This is Doctor in the House. Let me just remind our listeners and viewers that you can call us at 572-9710. That's the fixed line, 572-9710. Or you can WhatsApp 287-0971. WhatsApp is 287-0971. Doctor in the House brought to you the compliments of La Place Salazon, the Library Credit Union, and Tapia Hospital.
Tapia Hospital's pharmacy is always well stocked to meet all your prescription and healthcare needs. We also offer specialty drugs for cancer patients and for various other medical conditions. Call our pharmacy at 459-2400. Tapia Hospital, where the patient safety comes first.
At Library Cooperative Credit Union, we have one simple goal: to help you grow. Because when you grow, possibilities expand. We're about growing wings, growing ideas, growing you. This is your time. A time when your plans and dreams fall into place. When what you thought to be impossible with our support is indeed achievable. And best of all, it's a time when you can look back and see your growth. So, on life's journey, set your goals high. We'll be with you every step of the way. And as you grow, so should your opportunities. Library Cooperative Credit Union. We're not a bank. We're better.
It's delicious.
La Place Salazon is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Place Salazar, of course. La Place Salazar. Castries, Rosalie, Beaufort, and Surage.
It's delicious.
Welcome back to Doctor in the House with Dr. Leonard Surage. Dr. Surage, it's back to you.
Thank you once again, Andre, and thank the general public and the listeners and the viewers. Remember, to make your contribution or to add to our contribution, you can call the landline at 572-9710 or WhatsApp 287-0971. Now I have to answer your question.
Yes, Dr.
Right.
Surage, because you try to ease our mind where favoritism and so on and cover up, because we hear about cases where things happen that sound like doctors were not being careful and this sort of thing. And if these things are taken, remember one time I think there was a case where I think a lady got her leg amputated.
Yeah.
And that was a mistake. I remember that it was the wrong limb that was amputated, etc., etc. So those kinds of cases, if these things are brought before the Medical and Dental Association, right, how can we be sure that the doctors, your colleagues, would not be gathering forces to ensure that one of their own is protected?
It sounds like an element of distrust, but the role of the council is exactly what you said. If the council has to get involved, somebody has to write the council and say, look, my mother was in the hospital, my mother's limb got cut, and it was the wrong leg, etc. So we are seeking redress. The medical council has a particular system in place to look at where the issue lies and try to resolve it, try to listen to both parties. What they would generally do is to ask both parties to submit a report. And from the report, there's an investigative element to it to find out. Now, medical association don't come in that at all. That's not a medical association affair. It is a council that is looking for where justice is to be used.
So you're saying when a case like that is filed, okay, somebody, as we said, writes a letter of complaint.
Yeah.
So this goes to the council or the Medical and Dental Association? To the council.
Medical council. Now, in these deliberations, and there have been many of them. There have been times when people working for government have been sued, etc., and it has been settled for lots of money. So if you look in the archives, you'll find these. However, there has been no time when the doctors mount a protest because of that. That's number one. Number two, if you look at the negotiating items for the doctors, where the Medical Association is negotiating for better quality of better condition for their doctors, many of these items are partly relating to improving the quality of care in the hospital and in the health centers. So they're not looking only give us more money. It's about, we feel that the waiting is too long. We feel that you should put more staff there for A, B, and C to make the life of the patient better. Even things like paternity leave, etc., and so forth. These are the things that the Medical Association agitate to make it better for the patient.
So when you say when the council passes quote-unquote judgment, you say in there are cases where doctors or somebody have made payouts already, substantial amounts?
Payouts, yes. As to if the doctor, because all the doctors are protected by, they have insurance, malpractice insurance, and that is an essential part of it.
Okay.
Because a malpractice may not be you practice badly. It is the unforeseen circumstances may arise, whereby if you are, say if I'm doing a thyroid operation, there is a chance that the voice can get weak because of the way the nerve runs behind the thyroid. Now, if perchance it happened that that particular patient had a very difficult case and the voice is weak, that's not considered malpractice. because before the operation we would tell you this is possible, that is possible, that is possible. So malpractice is when there is neglect. I call you because I have a problem and you didn't answer, or you knew you operate on me and things are going bad. I'm looking for you, I can't find you. So that is the kind. So many people believe malpractice is just any unusual circumstances lead to malpractice, but it's not. It is not the case at all. It is when there is negligence. In other words, the expectation of the doctor was not met.
Like the case of the limb.
Yeah,
That
yeah,
was-
because
yeah.
obviously that was, from what I know from the general public, general conversation, it is something that if you had due diligence in many ways, it could have been avoided. Because generally, even sometimes when I do operation at St. Jude's, you have to, the side of the body that you're going to operate on, whether it's a leg, whether it's a knee, whether it's an eye, you usually mark it in pen before the patient leaves. So these are standard things. And things like what we call a WHO protocol. The WHO protocol is that before an operation starts, the parties, the nurses, the one particular lead nurse will halt everything and say, look, let us do a WHO protocol. Do you know the name of the patient that is lying there? Yes. What's the name? What procedure they're having? Is the site marked? And the patient is still awake. And what instrument you'll require for that operation? You tell them. And do you have all the equipment you need? Yes. Is it properly sterilized? Yes. And you go through a list of questions before you put that patient to sleep.
So you're saying in cases where judgment is against a doctor, for example, it's not necessarily the doctor, the one footing that bill. It is actually his insurance.
The insurance, yeah.
All right,
Because
okay.
all of
Got
them
you.
are covered by insurance.
Insurance. Okay, we have a call. Thanks for holding. Good evening.
Hey, good evening, Andre. Good evening, Doc.
Hi, good evening.
Good evening.
Yeah. How are you, Doc?
I'm good, I'm fine. Waiting to hear from you. Let's hear you.
Okay, Doc. Thanks for accepting my call, huh?
Okay, all right.
Doc, you said a good doctor depends on his employer.
No.
Can be
What I
part of
said is that the employer's expectation of what is considered a good doctor may be different from what his colleagues may think. So what I was saying is that for when we say this is a good doctor or this is not a good doctor, we, depending on whose eyes we are seeing it from. So your colleagues have certain expectation of you. Your employer have a certain expectation of you.
And the environment.
And
where you work.
the community have an expectation of you. So you,
So,
yeah, go ahead.
so the environment have to do, you can say the environment include, your salary, everything, though?
No, I'm looking at the environment as the community you live in. If they see something of a medical nature, they would inform the authorities. Or if they feel that there is need to have a talk on alcohol abuse, they will set up a committee for that. So they assist the environment or the community.
Yeah. Doc, what I see we lack here, Doc, among our doctors, like, for example, when you go and see a doctor and you have a certain ailment, certain sickness, and they see that sickness, for example, cancer, like in the 4th and 5th stage, they will not, some of them will not tell you the gospel truth. Because stage 5 cancer, I don't believe it has any cure.
Okay.
And instead of making that person spend money like to go overseas, it better to tell the patient, look, you're in that stage. I am not encouraging you to go overseas and spend money for treatment. That will be a waste of money. Some of them don't see that, and I wonder why. Even if the person has the money to go, but even if that person go, there'll be just a waste of money. This person won't get any better. This person won't get any cure. Why won't the doctor tell the person, hey, it is a waste of time and a waste of money to go overseas and seek treatment?
So you asked him that question, okay?
Yeah.
The issue here is that we are talking in a vacuum. I don't know which patient, I don't know which stage 5, I don't know many things, because every cancer behaves differently, number one. Whereas a stage 5 cancer we consider to be inoperable, that's advanced. It all depends on what discussion that is held between the two parties. So you will not draw me into an argument to make me believe that the doctors deliberately make the people spend their money uselessly.
I won't say deliberately, Doc, because, Doc, I can bear witness to that. I know people who went to the doctor with certain sickness and about that same stage 4, stage 5 I'm telling you there. And the doctor was aware that this person will not get better even if this person goes overseas for treatment or for whatever. He knows that. You could have just tell the patient or the family members, look, I know you'll have the money to go to get treatment or whatever, but it will not happen because the stage this person is in there right now, it cannot bring the person back, and it will be just a waste of money. And some of them don't want to say that, Doc. I don't know why. And the person went Matnik, and the person when the person reached there, about 4 days the person died. And the person had to come back to St. Lucia to bury it.
And
so if you've seen that, if the doctor is seeing that, I sure some doctors are seeing that the person cannot make it. No matter what happened, no matter where the person goes, the person cannot make it. Just tell the hard truth that, look, it is a waste of time. To me, all these things, if a doctor said that, these are what make doctors good doctors. Profession good doctors.
Well, we had that in terms of your ethics and in terms of your honesty, all these things come into play. Now, as I said, you just picked up a case from a bag and asked me to comment on it, but every case has to be looked.
You're not aware this have happened? You're not aware anything so have happened?
But I don't believe a doctor would deliberately mislead you into...
Yeah, I agree.
They will not... I do not know what circumstances surrounded that particular one. Because at the same time, you hear somebody say, hey, the doctor say he'll die in 6 months, 5 years, he's still alive. You understand? Yeah. So, and they always tell you the doctors are not God. So, we do not know what pressure was put on the doctor to send them away, because you know also...
So, Doc, and my final point, let me drop the line. But you believe a good doctor has to tell the patient or the family members the truth about the person's illness?
Of course. And that's you've been trained to do that. And this thing about...
No matter how difficult it is,
of course,
you have to say.
Absolutely, you have to. And as a matter of fact, if the patient cannot take it, you bring the relatives, the next of kin relatives, and talk to them and tell them this is what's happening. If the patient is not in sound mind to understand it. But that information must be given so that people can make their choices and can make their plans, can do things, and even to make their will. You have to tell people that. Serious consequences.
So
and we've been trained that way.
So, Dr. Surage, what about a situation where you have maybe a world leader, okay, like in the case of Pope Francis recently, where you had doctors coming out and giving statements and so on, giving the impression as though the gentleman was okay, right? That's the impression that they were giving, and that wasn't so at all. He was very, very, very sick. So you're saying there's one standard maybe for the family and another standard for the public. And the same thing with Joe Biden, for example, the former U.S. president. He is ill. In fact, now they're asking a lot of questions. How could that have been missed? Right? So, and you heard these doctors say, oh, he's in perfect health. They say that all the time. So it's these things that bring the profession into disrepute. People say, well, they obviously trying to protect, and that means now that they have to be telling lies.
Well, this is the politics of it. I am not getting into the politics of it. All I'm telling you is that we know we have been trained, and it's not like yesterday. You keep on hearing people, doctors not telling the patient the truth. That is not so. If the doctors don't know, if you do a test and you suspect somebody may have a cancer, but you cannot prove it, you cannot go and tell anybody you have cancer. You don't know. No matter what your suspicions say, because it will boomerang one day and you'll think it's cancer they have and they didn't. And your reputation will go down the drain because you mislead them.
Mm-hmm.
So unless you have enough evidence to prove it's a cancer, you can say you suspect it is this, you suspect, but you cannot say it is because you don't know. It is only the pathologist who is the key person there that can look at a sample and say A, B, or C. But you can only surmise, you can only assume it is that. And of course, in preparing a patient, you can give them the possibilities, but you must never hold that information from patients and their relatives.
But don't you think, Dr. Surage, I'm not saying that this is what should be done. I'm putting a hypothetical situation. Somebody has stage 5 cancer. It's one thing to tell the family. It's another thing to be honest with the patient and say, hey, listen, there's nothing much we can do for you anymore. Wouldn't that sort of quicken the patient's demise? Because they would go into a tailspin at that point in time. Is it the wise thing to do?
You have to use your judgment. And medicine is a lot of judgment. Can the patient's constitution take it? Is the patient sound in mind and body to be able to use that information sensibly?
Mm-hmm.
And so if you think the patient may not be, then you may not do it alone. You get a team of your colleagues and say, well, doc, tomorrow I want us to have a meeting. I have a particular situation I want to assistment in resolving it. This is a situation, and I'm thinking of telling the relatives and the patient, etc. And they would assist you with their wisdom as to how to proceed. But it would be all the time in the best interest of the patient. But at the same time, if you decide not to tell the patient because they may not be able to accept it, and as you said, it may precipitate their fears and their demise, but you have to tell it to somebody, the relatives, in close session. You have to. You cannot keep it to yourself. And that is why sometimes I do not think a doctor will deliberately have the information, clear about it, and mislead you. And that's why it's always good to look at the circumstances that surround each case, because each particular case have their particular circumstances that influence decision. And that is where the practice of medicine get extremely rough and extremely difficult, because sometimes you carry this burden to your home, to your bed. You can't even sleep at night.
Mm-hmm.
And your family wonder why you're so aloof, or because you're carrying patient's problem in you. You can't just ditch it out and come in the house. And so again, back to empathy, you have to feel the trauma the patient is going through. And you may not internalize it yourself, but then you understand what's happening.
Mm-hmm.
And
what in terms of are there rules that govern things like, say, for example, you have a general practitioner. Somebody is dealing with a doctor is dealing with somebody who has some throat issues, right? For example, And it's clear that this general practitioner has gotten to the end of his expertise. There's nothing more he knows or she knows that they can really do for the patient, right? Are there any rules in place that would dictate to, say, a general practitioner when he or she should now say to the patient, listen, I think you need to see Dr. Surage. This one is beyond me. Are there any rules governing those things, or can a general practitioner just keep prescribing medicine and so on to a particular person that they know they really can't help anymore?
Well, there are two parts to that. One is the legal element of what a doctor can do and what a doctor cannot do. And secondly, your moral obligation as to where you feel your limits lie. It is very difficult for another entity to tell you what your limits are. However, if you have never removed somebody's tonsils and you've never done an operation and tomorrow you book the patient to do a removing of tonsil, obviously you're acting outside of your regular capabilities. But a general doctor, having been trained in the art of medicine and surgery, because it is a bachelor's or a bachelor's degree in medicine and in surgery. So, and during your course of training, you're exposed to a lot of things, some more than others. So it is difficult for the law to say that you cannot do that.
Mm-hmm.
More so since you may be a general doctor, but you have worked with an ENT doctor for 15, 20, 25 years. You know things that you have done things and you know. So, whereas you're not a specialist, but there's nothing that stops you from doing it. So, with the practice of medicine and being given a certificate to practice, there is no clear delineation as to where your skills stop.
Mm-hmm.
So legally, you may not win that argument based on whether you can do it or not. It may be when last you were exposed to it, when last you did it, have you ever done it before? On the other hand, your own internal ethics should tell you where your limit lies. And the thing about medicine is what they teach you is to know where your limits are, where you can continue and where you should pass over the problem because it is beyond you.
But it's not a little disconcerting, Dr. Surage, for the patient. I mean, who probably doesn't realize that this doctor can't really help them anymore. Because I've heard, like, for example, the natural healers, natural medicine and so on, made statements like, well, I mean, now you're coming to me. At this stage now, you know, that's when you're coming to me right now. So it's as if maybe the patient themselves just got to the point where they realized that there was not much that could be done, this particular doctor that they were seeing. And by your own admission, you see, apparently there's no sort of overseer, or, you know, no one to oversee the general practitioners and to instruct them or to keep an eye on them in such a way that they can say, hey, listen, you are now obligated under such and such a thing to pass this on now to, from what you're saying, that does not exist.
No, but I think you're distorting the thing quite a bit yourself.
Mm-hmm.
Because it is not a situation where the doctor is holding on to a patient because the patient may be coming with different kind of issues. And it is, whereas the law does not make a clear distinction, but the fact that you talk about oversight, there is an oversight. It's not that nobody is complaining. These people you're talking about, have they ever complained to anybody else than bad talking people?
Well, Dr. Surage, our people have a way about us where we do not like to complain. We go to a doctor. I know many people like that. They go to a doctor, they remain mum. They don't say anything. They don't talk. It's after they leave the office, then you hear them talking, telling, well, the doctor pricked me hard and this kind of, you hear those things. Mm-hmm. But while they're in there, they don't really say anything because they figure they're supposed to remain docile and just accept what the doctor is saying because doctor knows best. So you have those kinds of situations. And how do those people know when it's time to move on?
Well, the way they do it is that you go to the doctor once, maybe the second time same medication or whatever, a third time. After a while, they find themselves going to the specialist, and that's how most of them come to me. A few of them from medical centers are being referred, but many of them walk with their feet and come to me.
Mm-hmm.
This is not the desirable situation,
Yes. Mm-hmm.
but they find a way of getting there, and they talk to people. They say, "Have you tried this doctor? Have you?" So it's not like, as you were saying, that a patient will be helplessly just seeing one doctor as if it is tied to that doctor. The patient we are free. We can do whatever we want. We can go to whichever doctor. As a matter of fact,
That's true, Dr. Surage. But how does the patient know when that time has come?
When they're not getting satisfaction with one particular doctor, and that's how mostly it happens, that you go to your doctor, the same medicine, and they would give me the prescription, same thing, or it's not getting them better, so they go, and they would come to me too. They have ringing in the ears, which generally there is the treatment are not very satisfactory, and sometimes it may persist, and they would go doctor, not knowing that situation have a self-limiting thing, and there's not, but they do it. So the patient have the choice to be able to go, especially if they are paying for the service. If you're in government service and you go to a clinic, you have no choice but to deal with a doctor.
Mm-hmm.
But they have choices. There's nothing that limits them.
So the advice that you're giving us, Dr. Surage, is if that you, as a patient, you don't feel satisfied with the treatment that you're getting, you're not getting better. Mm-hmm. So you now have an obligation to protect yourself and to ensure that you get the best medical care, and you make a decision for yourself that you need to move on.
Well, you can. That is one way of doing it, but I'm not recommending that. I'm saying that the doctors must take care of the patient and know. And as you started in the beginning, you said, why is it that they're not referring? And I think that if the doctor feel they have reached their limit as to the extent to which they can take care, then they refer the patient. And maybe they still feel that
they can handle it.
Mm-hmm. But there is no law that can tell you that, no, I cannot see you again after 3 times, please go somewhere else. So that is the way the practice of medicine.
And this is how it is across the entire world? That's how
I think so. I think especially, but there are areas where, say, if you are in Britain, you are assigned to one doctor and one team. That's where you are. You can't go anywhere else. Unless you want to pay your money and go privately. But you are attached to this clinic, and that clinic is where all your information is, and that's where you go. So they have no choices.
Mm-hmm. But I like the advice. Dr. Surage. I hope the public is listening, and that if you don't feel that you're getting satisfaction, you're not getting any better. It's the same thing, the same medication, whatever. Then you need to make a decision for yourself. Agree?
But that's what they're doing. I mean, that's not even an advice. It's just a commentary.
Yeah, but Dr. Surage, you have to admit, not everybody will act like that. Not everybody does that. There's some people, I say, they just docile. They just figure, this is my doctor. I've known him since I was a child, that kind of thing. And this is where I'm sticking, kind of thing.
Well, but remember, faith plays a lot of part in there, And they believe in their doctors, just like sometimes they believe in their politician, or they believe in their nurse. So
exactly.
So the belief is very strong. But I think the doctor should separate the science and say when, and I believe that is something that we should encourage our doctors to do. When you think that you can no longer you take care of that particular patient, just pass it on. Find somebody who can deal with it. Of course, we have situations where we don't have specialists to deal with it, like allergists and respiratory physicians, etc. So we have to send to the next closest profession. But these challenges do exist.
Yes.
Whereby you don't have the particular specialist to refer to.
Okay.
Yep.
Yes.
So, where are we in time?
It's after time already.
Well, I think you've engaged me quite a bit today.
As I normally do.
Yes, you normally do. Yeah, well, we had one call, and I'm hoping that it stimulates some kind of thinking on that particular topic. We never really get to how we got stuck at what the doctors fraternity think of him. We never get to what does a patient think of the doctor. We would have got to that. Or what does the hospital think of the doctor? Because it don't make sense you seeing a patient and ask for the most expensive tests and run the hospital into debt because you didn't choose your investigations properly. So I think all these elements are important in how you impact on society and how you impact on your colleagues, etc. And I'm hoping that at least we got some people to open their eyes and open their minds to the responsibilities of a doctor from all perspectives. Next week, same time, we'll meet again.
Thank you for your service, Dr. Surage. You've been listening to and viewing on Facebook, on YouTube, and on X, Doctor in the House with Dr. Leonard Surage. Listen again and view again next week, Tuesday, same time, 6 p.m. to 7 p.m. for another Doctor in the House, brought to you with the compliments of Maison Salaison, the Library Credit Union, and Tapio Hospital.
At Tapio Hospital, we operate a 24-hour emergency service for all your urgent healthcare needs. Our qualified medical specialist will be on hand to ensure that you receive the best of care. Call us at 459-2617. Tapio Hospital, where the patient safety comes first.
At Library Cooperative Credit Union, we have one simple goal: to help you grow. Because when you grow, possibilities expand. We're about growing wings, growing ideas, growing you. This is your time. A time when your plans and dreams fall into place. When what you thought to be impossible with our support is indeed achievable. And best of all, it's a time when you can look back and see your growth. So, on life's journey, set your goals high. We'll be with you every step of the way. And as you grow, so should your opportunities. Library Cooperative Credit Union. We're not a bank. We're better.
It's delicious.
La Plaza Salazar is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Plaza Salazar, of course. La Plaza Salazar, Castries, Rosalie, Beaufort, and Soufriere.
It's delicious.
Rev-Up St. Lucia is located at Unit 4, Gablewoods Mall, Sunny Acres, Castries, St. Lucia. Tune in to us at 97.1 FM and online at revupslu.com. Call the studio.